Hi, welcome to WCOT Radio, Delaware's #1 source of health news. I am Brad,
I'm Shajil.
and in today's show, we look to raise your awareness on multiple sclerosis. We will be talking about how to recognize the signs and symptoms, and also the effects that MS may have on the body.
So today our guest is Matt Montano, who is an occupational therapist in Delaware, who specializes in treating patients with multiple sclerosis.
Alrighty, so we have Mr. Monteo on the phone now. How you doing, Mr. Monteo?
I'm good, Brad. How are you?
Doing good. So our first question for you today is, what is occupational therapy, and can you let our listeners know what that is?
So, in its simplest terms, occupational therapy and occupational therapy assistants help people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities or occupations.
Hi Matt, this is Shajil. Can you tell the listeners what is multiple sclerosis?
So, multiple sclerosis is also known as MS. It's a disease caused by an abnormal response to the central nervous system. In this disease, the myelin sheath that covers nerve fibers become inflamed and destroyed, leaving scar tissue behind. As a result of this, electrical impulses are not readily sent to their locations, and conduction of these impulses is difficult.
Okay. So next, what are some signs and symptoms that people can look for, just to point out to their doctors if they do see it?
So symptoms vary between patients, but common symptoms are blurred double vision, color distortions, dysesthesia, urinary incontinence, muscle weakness, gross and fine motor incoordinations, fatigue, ataxia, dysphagia, dysarthria, vestibular dysfunction, cognitive or emotional disturbances, and optic neuritis.
Okay, Matt, can you tell us the effects on multiple sclerosis on the body, just in simple terms, like how it affects daily life, body functions, and one body function can affect the other?
So, just like we were just discussing, the symptoms vary from patient to patient. Some may experience visual problems, fatigue, and cognitive deficits. So, as a result of this, many people have difficulty performing self-care or activities of daily living, such as dressing, grooming, and self-feeding due to motor incoordinations and fatigue. In addition to this, social participation may also be impaired due to emotional disturbances and cognitive difficulty.
So our last question that we have for you may encompass a lot, but what we want to do is ask, what is the value of occupational therapy in treating patients with multiple sclerosis?
So, as occupational therapies, we take a holistic approach and we focus on occupation, which is defined as all the tasks and activities that take up our time and energy and provide meaning and focus in our lives. As occupational therapy practitioners, we focus on enabling people to participate in their occupations that have value and meaning to them. We are valuable to this healthcare profession because we're able to recognize, evaluate, and offer intervention to people with MS and their family members to address three broad areas of occupation. So self-care activities such as mobility, dressing, bathing, grooming, productive activities including work, home management, caregiving, and volunteer work, and leisure, including involvement in social and recreational pursuits. Our value is also demonstrated in that we're able to identify barriers in different contexts that affect our clients' participation in their occupations. By identifying these barriers, we can use interventions to focus and remove or reduce these barriers. Interventions can take many forms, such as prevention, education, consultation, compensation, and remediation. Also, in our practice, we focus on health promotion and wellness. These are important aspects of our practice because they prevent future decrements, diseases, or disabilities from developing by helping our patients to promote their health and wellness.
All right. Well, that is a lot. Hopefully that the listeners, they took all that into consideration and are able to go out and understand the different signs and symptoms and things that may affect them, and also if they have family members that may have it, they're able to assist them in any way. Matthew, we'd like to thank you for joining us today.
Yep, thank you too. Thanks for having me.
Thanks, Matt. This is WCOT, Radio's Delaware's #1 source of health news.